Hi and welcome back to another video of Medic Notes. This video is on blepharitis. For introduction, blepharitis is a common disorder of the lids, which may cause persistent and annoying symptoms of irritation, watering, and redness. The signs are often minimal, yet symptoms may be severe. There are two main varieties, staphylococcal and seborrheic. For staphylococcal blepharitis, this is primarily due to infection of the lid margins by staphylococcal bacteria, such as Staph aureus and epidermidis. The lid margin is inflamed and coated with scales. The lashes are stuck together by crusts. This picture shows eyelid crusts. Next, for seborrheic blepharitis. This variant can occur in association with seborrheic dermatitis. The abnormality is an overproduction of sebum by glands at the lid margin, especially the meibomian glands. Bacteria metabolize the sebum, producing irritant-free fatty acids. The lid margin is less inflamed than in staphylococcal blepharitis. Careful examination will show plugs of sebum in the meibomian gland orifices and a foamy tear film. This picture shows the meibomian glands seen at the upper eyelids. Both types of blepharitis frequently overlap and may be indistinguishable from each other. Both can give rise to a secondary conjunctivitis, which may not be infective, and to punctate corneal epithelial erosions, seen after instillation of fluorescein and examination with a blue light. Other associations include disturbance of the tear film, corneal scarring and vascularization, especially of the inferior cornea, peripheral corneal ulceration and infiltration, eyelash abnormalities, such as inward growth, trichiasis, whitening and loss, sty, internal hordeolum, chalazion, and acne rosacea. This first picture shows a style at the lower eyelid, and the second picture shows a chalazion. For management, it is directed against the presence of scales, crusts, and sebum, against bacterial infection of the lid margins, and to supplement tear inadequacy. Treatments include lid hygiene. Cotton-tipped buds, cotton wool balls, or a soft cloth soaked in warm water, are used to rub away scales, crusts, and sebum, to reduce the bacterial load, and to express plugged meibomian glands. Antibiotics. Topical antibiotic ointments, such as chloramphenicol, cling to the lid margin better than drops. Systemic antibiotics like tetracycline and doxycycline, for 6 to 12 weeks at a time, may be used in severe or persistent cases. And artificial tear drops. These give considerable relief, and should be administered on an, as often as necessary, basis. There are many types available. Patients may need to try several before finding the one that suits them best. Acute infection like external or internal hordeolum is helped by warm compresses. If severe, especially if there is associated cellulitis, surgical drainage and systemic antibiotic use may be required. It should be emphasized to patients that the condition is chronic and relapsing remitting, and that it may not be possible to effect a complete cure. Relief of symptoms depends on good motivation and regular treatment, particularly lid hygiene. That's all for this video. Thank you.